In this lecture, we'll be expanding upon EMS's role in public health by talking specifically about disease and injury prevention. Prevention can be summed up in the 4 E's. First, education, then enforcement, then engineering, and lastly, economic incentives. So with education, people don't always know how to appropriately react to not put themselves at risk. I'm sure, hopefully not you personally, but maybe you, but you more than likely know somebody who does risky behaviors, drives their car without their seatbelt. Educating people why seatbelts are useful and how, yes, they may cause injuries during a car accident, but an injury that's caused by a seatbelt is much better than dying from not having the seatbelt on. So we have to educate the patients to the potential dangers and then persuade them why they need to change their behavior, why they should be wearing their seatbelt. It's like teaching a child sometimes why they shouldn't jump off of the bed onto the couch next to them, why they need to instead get off the bed then walk over, that jumping across can be dangerous and how they could possibly hurt themselves. In order to be effective in your education, you need to, 1, tailor it to the group you're talking to. Me trying to educate you on the danger of jumping on the bed isn't going to land quite as well as it would with children, because you more than likely know not to jump on the bed and why you shouldn't. So I need to tailor it to the group that I'm talking to. You then need to reinforce it with rewards or more than likely the repercussions if they don't adhere to it. We do a lot of this education piece. We do DUI rodeos instructing teenagers why they shouldn't get behind the wheel if they're impaired. We could go one route and tell them they shouldn't be drinking at all, but that's probably not going to curb their behavior. So instead, we'll show them why drinking and driving or driving impaired is a detriment. Have things like the drunk goggles and get them to understand and to see. We can educate them while also letting them have fun and learning and seeing, and they can mess around in this environment and see that it isn't safe because it's still safe and structured where we're currently teaching them. Next will come enforcement. Unfortunately, not everybody can be persuaded or taught through education. So there's got to be some type of repercussion when they engage in dangerous activities, if it is something that will then result in harm to others. I'm not going to enforce laws about jumping on the bed, right? That's not going to hurt anybody other than yourself. But going back to drinking and driving or impaired driving, that could very much result in injury or death to somebody else. So that's where we have laws that are going to enforce the dangers of drinking and driving or driving while impaired. The enforcement piece is less on EMS's side. So we can do a lot with education. We really can't enforce, right? That's going to be where legislature is passed, and then the police department or other bodies are going to be the ones to enact or enforce those laws. Other important legislation and regulation that are good for prevention. So seatbelt laws, child safety restraint system laws, things along those lines. Next up is going to be engineering or environment. So this can be broken down into passive interventions or approaches that can be a little bit more forceful. So passive interventions would be just not giving them any other option by changing a design of something in order to make it where it's naturally going to be safer. Think child-resistant medication bottles. We don't want children getting into medicines, and we can educate the parents on why they need to keep medicines away from children. We can enforce laws that would make it a child's safety risk, and they could be prosecuted for child endangerment for allowing their children access to those medications or not appropriately securing them. And then past that, we can create child-resistant medication bottles. So the tops, the tamper-resistant bottles, so that the children just cannot get into it. And lastly, we can have economic incentives. This can either be free, like something that is completely, truly free, or something that's subsidized. So safety products, doing things like car seat drives, where you have people that come out and are having The fire department or other entities helping them put in car seats, but also you can raffle off car seats while you're there. A lot of stores, if you do have some type of old or outdated car seat, will let you trade it in for a discounted rate on a newer, safer version. So make it where it's attainable and it's in their best self-interest to engage in those incentive practices. Where EMS really does come in the most is going to be education. So getting out there and teaching people why those particular behaviors that they're engaging in are bad. Passive interventions like the child resistant or tamper resistant bottles are often the most successful. You just don't give them the ability to engage in that dangerous behavior or to keep it from having the effect. Sprinkler systems being required in commercial buildings. That's costly to the builder, but it's safer for the people within it. Making it where it is standard and required for all cars to come with airbag systems. Things along those lines. You don't have to do anything additionally to keep yourself safe. It's just done at the onset of that particular product. Combining these passive interventions along with education is going to be what is best or what is going to work best for the person. So the airbags. Most cars do have the airbags, but they also have a way where you can normally turn off the passenger airbag. So educating why airbags are important will lead to people leaving those on. And so that passive intervention, the car comes standard with airbags, coupled with our education, why the airbags are important, will keep people from tampering with those automated systems. You are involved in the education and mostly intervening before the injury occurs. So this primary intervention. In one of the previous lectures about public health, I talked about moving the rug if you have an elderly patient who keeps tripping on it. That's the primary intervention. It's not helpful when they've already fallen and they've already broken their hip for us to come in and be like, oh, that rug really should be moved. It would have been helpful the previous times when we were there for lift assists to move it. Some other big educational pushes that helps with primary prevention is going to be CPR training. So getting out there, and this is less injury, this is more just longevity from the medical and community safety standpoint, but going out and educating the public about how to do CPR. Doing hands-only drives. They set up those little booths in a lot of airports where while you're waiting for your plane, you can come in and you can do some compression practice. Secondary prevention is going to be after the injury has occurred to keep the problem from getting worse. We also have a big role to play, and this was our traditional role before we started doing a lot of big education and prevention pushes, where it's already occurred, I can't take it back, but how can I educate the patient on being more safe next time? You get called out to a neighborhood for a child who fell off their bike, and you're there because they have a goose egg on their head, they've got a fairly large hematoma, parents are freaking out, child is freaking out. You can't put that child in a helmet prior to this fall, but you can educate the parents on why they would need a helmet for the next time that the child rides the bike. Our switch from secondary prevention to primary prevention is so that we can cause less YPLL for our communities. And that's that years of potential life loss. So we want to intervene before it becomes a big issue. The fire department beat EMS to their safety initiatives way, way, way before we even started moving in. So they also do a lot of primary prevention. And just to kind of put it in perspective for where EMS should kind of eventually be hoping to go. So the fire department didn't do education about fire safety, about why you shouldn't leave candles lit, why you should have good working smoke detectors in your home, why you should sleep with your doors shut as they were fighting the fire. It's already occurred. The incident has already happened. They can do some education on the back end, but the person's less likely to be receptive to it because the incident has already happened. Instead, they do fire alarm drives within the community, and they go out and they make sure that people have good working smoke detectors. They do a lot of fire prevention week activities where they show people in the little burn buildings what and how much a closed door can stop. They teach stop, drop, and roll in school and other places. So they moved into primary prevention to keep people's houses from burning down. And in some areas, the fire departments don't run a whole lot of fires because of those community outreach events and them doing that primary prevention. We should strive to eventually move to that. We can't prevent all accidents, but we can probably help curb or lessen the effects of some of them. Other ways EMS can get involved. Again, promote those early interventions. Do primary education. Go out and do the DUI rodeos. If you're at a patient's house and you see something that could be a potential injury risk, educate them on it and see if you can help them design a better space for them to live in. Some places, their EMS providers help with immunization administration. So going out and educating the community on why it's important to get your immunizations, like your yearly flu vaccine. And then they work in the clinics to ensure that even low income places or places who wouldn't normally have access to other medical providers are able to get it. EMS is having a shift towards more community paramedicine, and this is slowly happening in our state, but it's happened a lot nationally. And that is this move towards injury and illness risk prevention. So before they call, we intervene. If we know we have a patient who is frequently using EMS because they're having problems managing their diabetes, well, rather than wait for them to call EMS, you'll have a community paramedic who will go to their home and will routinely or every once in a while just check in with them to make sure that they are taking their medication. They understand the insulin dose that they're on. Trying to intervene again before it becomes a medical emergency. The last thing I want to talk about in this lecture is something called the Haddon Matrix. So this was developed by Dr. Haddon, and it goes through the phases of an incident that causes an injury. And it's broken down into traditionally 9 components. I know the one on the screen has more than 9, so it's going to have, 12. And it is because one of the categories has been broken down into physical and social environment. So normally this is just one. We traditionally, as EMS providers, have been trained to live in this post-injury. So pre-injury, before the incident occurs, how can we intervene before it happens? This particular table is breaking down gun violence. So a gun is fired. To keep the gun from being fired, we could appropriately offer mental health if it was some type of person who is having a psychiatric. So they're shooting at people or they're trying to harm themselves. Get them into substance abuse treatment if they had some type of addiction crisis. Keep them from getting the gun in the first place, so better screening. The next one is the injury. So pre-injury or pre-incident, then injury or incident. So the gun has been fired. So once it has happened, where can we intervene? We can stop the bleeding. We can treat the injuries that have occurred. And then lastly, post is the victim's been shot. We're dealing with the back end of it. So for this particular graph, it's dealing with the access to mental health and to other resources. So long-term treatments, taking care of the injuries that the patient may have. EMS mostly has lived in this post-event phase. So in the event and post-event. So we show up after it has happened. Our shift in trying to be good stewards of public health should be trying to get into this pre-injury phase more. So where we are stopping the event prior to it happened. You are uniquely qualified to speak to the problem and compel others to examine a problem more closely. So if you see that you are having continual responses to the same type of event or the same type of injuries within your community, you are in a unique position to be able to speak up and push for the change. Not to keep using the exact same example, but it's kind of a good one. If you keep going, or you know you and your coworkers are continually going to the same person for trip and falls, you're living in that post-injury, that post-event phase. You're constantly there helping them up. Your job as being a good steward for that patient, being a good advocate for that patient, should be to move into the pre-event phase. Figure out what they're tripping on. See if you can limit how much they come into contact with that. See if you can make their homes safer for them to walk around in. If to get from their kitchen into their bedroom, there's a couch that's in the way that makes it where they can't use their walking assisted device to get through there because it's too wide, and so they have to switch to a cane, and they keep falling when they're trying to switch from one to the other. See if you can move the couch a little bit so that they're able to get what they are most comfortable using straight shot into the bedroom.